Hi, and welcome to Coping During the COVID Crisis. I'm Janet Gross. Well, for months now, we've all been dealing with this changing world, seeing our freedoms come and go and come back again, hearing different predictions and stories from different politicians and health officials. For some of our most vulnerable population, though, non-definitive answers can be so confusing and upsetting. And sometimes that can build into stress and depression, even anger. Today, Dr. Roy Salgado, professor of counseling at the University of Holy Cross, is here to talk about that and ways that maybe we can manage those fears and frustrations. This is real. This is real. They're seeing people go out, but, some of the most vulnerable either can't or don't want to go out.
And it's frustrating, to know that, there's certain limitations as to what is perhaps in one's own best interest. To see that other people perhaps are starting to do a little bit more, starting to be able to engage in other activities with others, and to think I'm one of those individuals that falls into that category of vulnerable populations, and so it may not be in my own best interest to necessarily expose myself to the virus. And it's got to be frustrating. And it's one thing when everyone is experiencing it at the same time. Right. The whole world is in lockdown. But now that people have, on their own, along with guidelines, been able to phase into being able to do a few more things, to be among those that still is in the same situation as perhaps the whole world had been in 2.5, 3 months ago, it's heartbreaking and it's frustrating and perhaps even infuriating on some level.
Exactly. You feel like you're kind of left behind.
Right.
You want to have coffee with people.
Right.
You want to be able to go out or to feel like you can breathe again outside of your house.
Right.
But and who really wants to be labeled vulnerable,
Right. And to be told by others, it's not in your best interest, so we're not going to come and see you, or we don't want to expose you to anything because we don't know if we have been exposed. We don't know if we have had it and have been asymptomatic. We don't know if we have the antibodies. And so in the not knowing of any of this, people perhaps are making decisions to not interact with people that they perceive to be at risk. And it's a difficult situation to navigate.
Right, and sometimes that can sound like, I don't want to go over and here's my excuse.
Right.
And that may not be true, but it might seem like that.
Right.
To some people.
And so with that isolation and that sadness and depression that goes on with what appears to be, or feels, or could be perceived rather, as a rejection, as an othering, is something that can impact a person negatively, and perhaps they develop sadness and depression as a result.
Mm-hmm. And as they look at the future, they may not see when this might end for them. It's kind of, it seems like everybody else is working their way through it and able to get out there, but for them, maybe not. And they're, they might be watching people, get out, even with masks and stuff, and they're, they're still doing if they can get out, the hours, depending on if those continue, that they can only go for the vulnerable population, or,
it's important for those who have been identified as vulnerable populations to not necessarily take on that label in that way. Yes, perhaps you're vulnerable to this particular situation, to this particular virus. That being said, it doesn't define you. It doesn't identify you per se. You have strengths, you have abilities, you have ways to which contribute. I know a number of different people that have been identified as members of the vulnerable population who are still actively participating in their own special way. I know of people who are making masks for others, who are seamstresses and they can't go out there and about, but I'm contributing to the world. My mother is one of those who is sewing masks for people, but she's considered vulnerable population. My mother-in-law, for example, she's heartbroken that she hasn't been able to see my son in all of this time. But she writes him handwritten letters and sends him stickers in the mail, and so he says, "Oh, I got a letter from Grandma, and I'm able to see that she's still thinking about me." And so there are things that people that are considered vulnerable populations can still do to be engaged with the outside world, even though for now their restrictions are still recommended for them.
Right. I mean, you mentioned that. Here's my mask. I got it from Sewing Servants, and these are some ladies who are staying at home and making these for people.
Yes.
It's amazing the contribution that they make. And I'm with you totally. So, we've been talking about how the University of Holy Cross helps with a service that some people need, and this might be especially of interest to people
Right.
who are still stuck at home.
Yes, there's individuals who just don't have someone that they can reach out to because they're at home alone, and perhaps other people are engaged in other activities. They're going to work, or they're working from home, or whatever it is, and so they don't necessarily have the opportunity. That their times don't line up to be able to connect. So they may need to be able to process what's going on with them with a mental health professional because they're feeling isolated. They're feeling like they're being left behind in some kind of way. And if that's the case, then it's important for them to know that at the University of Holy Cross, our counselors in training are there to be able to offer that help to them in this time of crisis.
And then I'm going to say the number, but it's going to be on the screen throughout the show, 504-398-2168. And you can call and you can set up an appointment where someone will call you back and have a real appointment for 50 minutes.
Absolutely. The administrative assistant takes the call, triages it to the clinical director, and then he assigns that case to a counselor in training who will then begin the counseling process with you.
And for free.
And for free of charge.
This could be a concern for a lot of people who, especially the vulnerable population, who may not have the resources, and maybe they've never done this before.
Right.
So it may be a new thing for them, but if they can find somebody to help them do that, or I'm sure that they explain how to do it when they call the number.
Absolutely. And when they reach out to a mental health professional who perhaps can guide them through the next steps of what this is going to look like for them, to let them know that this is not something that is definitive for them as an individual, that it is an aspect of their current situation, but that they have so much more that defines who they are, and to accentuate those attributes and those qualities, and to really lift the individual up to realize, what, I am more than this label of a vulnerable member of a vulnerable population. I have much that I can contribute and offer, and for them to know that and realize that.
What a great thing a lot of people need to hear.
Certainly.
Okay, we're going to take a break. When we come back, we'll talk with some other professors of counseling at the University of Holy Cross.
The Willwoods community prays for the safety of healthcare workers, and we thank them all for their dedication and service during this COVID-19 pandemic.
To those on the front lines in hospitals, clinics, nursing homes, and testing centers, we thank you. We thank you for answering the call. The stakes are high and the challenges innumerable, with harsh conditions and no second chances. Yet our doctors, nurses, technicians, transporters, EMTs, pharmacists, and everyone who supports patient care are rising to the occasion, healing and caring for the most vulnerable in our community. You are our heroes. Thank you for the sacrifices you make every day, and especially during this pandemic. Your dedication, commitment, and courage deserve our deepest gratitude and admiration. It's with your help we will all get through this.
Thank you for joining us again. Dr. Dottie Martin, Associate Professor of Counseling at the University of Holy Cross, is joining us now to help us talk through some of this. We're talking about, obviously, the vulnerable population and how they may be in this for a little while longer, this kind of isolation, safer at home position where they really can't get out as often as everybody else is starting to. So, Dr. Martin, how can counseling help them through this?
Well, our counseling interns really are trained to assess and guide with clients. And so at this time, really being present with their clients, listening to them, normalizing what they're going through. They're experiencing normal experiences in an abnormal situation, right? It's an abnormal event. So really just being present with them, normalizing it for them, letting them have a safe place to express how they're feeling and what they're going through.
Right. Normalizing is something, you said that word, and I'm thinking, boy, you don't want it to be the normal way, but you're looking out of the window and you might be seeing people who are maybe not going about business as usual, but they're out there. And you're kind of at home because you are, quote unquote, vulnerable. And that's got to make you feel bad and different, and you might be jealous of the people out there.
Sure, exactly. And, giving the clients a place to verbalize that. And, really looking at changing the language. So when we say normal, like you said, their new normal is what they're seeing and what they're feeling. And so explaining to them, situational anxiety, situational depression, and, as well as helping them to understand that there are things that they can do, as small as changing their language and, accentuating the positive that they do have, helping them find that.
And you got to wonder, maybe for some people they have that in their family or with friends on the phone and everything like that, but for some people they don't have anybody, and that's got to be a little bit scary. And to have the opportunity to talk to somebody who is actually listening.
Right. So the power of their presence for the counselor intern, being present.
To Dr. Martin's point, if there's that individual who happens not to have a social support system readily available, to be able to remind them that they still have a lot to contribute by reaching out to a mental health professional, to a counselor, to kind of pick out those attributes, those traits, to let them know, you have a lot to offer. And this is a natural, normal response to an abnormal situation, as she said, and that this is situational. Your experiences, your symptoms of anxiety and depression are related to a situation and not definitive to some more prolonged mental health issue. And for someone to just hear that, yeah, this is a normal response. This is a typical response to this type of situation. Anyone in my shoes would be feeling the same way. And just to know that oftentimes can alleviate much of the distress.
Sure, that's got to help, because you're in the labeled vulnerable, but you don't want to be the only one who's going through it, and to know that, okay, this is right. This is the way, that it's going to happen for me and a lot of other people.
And a counselor can be a reminder of that. Yes, this is the way anybody would react under this circumstance. And so the fact that you're thinking this and feeling this and responding or reacting to this situation in this way is understandable, and we get it. We hear you.
Dr. Martin, is it special training that some of these counselors have to go through to really talk to people who feel isolated and who feel maybe that they're not like everybody else?
Yes, our counselors go through very much of that type of training, and where they are now in their internship and seeing clients. They've had the training and now they're putting that training into practice. And so it shifted a little bit doing telecounseling, and then it shifted it a little bit more with what we're going through in our society and in the world. But they are trained to deal with it. And I have been pleasantly surprised talking with them that they're really honing in on certain skills that they're using now with the teletherapy to really emphasize what they're doing. So using those active listening skills, sitting with the client and letting them process and being present is something that they're reporting to me that they've really, perfected or are perfecting using the teletherapy.
And for some people, they might not be used to teletherapy, so I guess you can kind of talk them through it. So if there is a hesitation, I don't know how to do that. What does it involve? How much does it cost? All those questions that some people might have, you'll help them through that if they call the number.
Absolutely.
There are people to make this process easier, because it's already difficult enough.
And the teletherapy seems to be easier for a lot of clients because they can pick up that phone and call. Transportation is difficult for clients. And so this is an easier platform for them to reach out to their clinician.
I think you can also do this by phone if you don't have the
Right, we have both options available. You can do telebehavioral health or telemental health or telecounseling through either a telephone, through just simply audio means, or the audiovisual means of using a computer or a smartphone through one of the numerous devices or platforms available on the market. Right now we're using both telephone and audiovisual technologies to be able to offer telemental health services.
Which is better?
I like them both. I like them both, and I like, personally, and I like the face-to-face. I see the benefits for all of the above, depending on the presenting issue and the client and where they are. The basic fundamentals are there, in terms of what you're offering to a potential client. And the opportunity to be heard, the opportunity to be able to express yourself and seek that professional help and guidance from someone is invaluable, whether it's face-to-face, telebehavioral health, or over the telephone.
Dr. Martin, what are the counselors in training? What's their thought about in person? On the phone or being able to see them?
It's been a switch for them, and some of them really like the in-person, and some of them really like the Zoom and the phone. But like I said, it's really challenged them to kind of step out of their comfort zone and really look at other skills that they feel really speeded up their process and being able to do that. That active listening is very important, and that is one of the hardest skills that our counselors have to master. Us as individuals, it's very hard. I think you both talked about that, really listening before. And so this has really been an asset for them in those arenas.
Okay. Well, thank you, Dr. Martin, and thank you for talking to us. And I listened, and I know Roy listened.
Absolutely.
It's such a great skill to have, to listen. So thank you very much for joining us. And we'll be right back after this.
Have you heard about social distancing?
This is very serious. We have to stay home.
Not just to protect yourself, but to protect others.
You don't want to spread the coronavirus in your community.
Stay at least 6 feet away from other people. 2, arm's length.
Staying home helps lower the risk for everyone.
Protect your life, protect your loved ones, and protect the world.
Just because you're at home
doesn't mean that we can't be alone together.
Together.
Thank you for joining us here again. And we're going to bring in Dr. Thomas Fonseca. He's an associate professor of counseling at the University of Holy Cross. And we're talking about the vulnerable population. As new freedoms coming up all the time, some people might feel safer at home. Some people in some areas might be asked to stay home, just in an abundance of caution or because the threat is still real. I guess when you're told to do something different than everybody else, you feel isolated. You feel set apart, and not in a good way. Dr. Fonseca, how do you help people deal with that?
Well, that's a good question. I think one of the easier things to remember is that we can always reach out to a friend, and we can always have conversations and keep that going and have that as a nice common thread through our days as we're dealing with this, as the vulnerable population is dealing with this. I think it's important too to remember that social distancing does not necessarily mean that we have to distance ourselves socially. So yes, physically we'd be apart from one another, but pick up that phone, or if the folks have learned to use Zoom or some other program, get in touch with our loved ones and keep in touch, and that's the best we can do right now.
And Dr. Fonseca brings up a very good point, as did Dr. Martin during the break, that social distancing is a term that perhaps needs to be reconfigured into physical distancing.
That's a much better way to put it.
It's a more accurate term, physical distance as opposed to social distance, because you want to keep that healthy distance so that you don't contract the virus. But at the same time, socially, you want to be engaged with those that are moving about in the world. And fortunately, we live in a time where that's possible with the telephone, with computer, with FaceTime, with a number of different platforms. And so to still remain engaged for your own well-being.
Right, because if you really boil it down, you want the community to last, your community, your individual, whether it's a family or a church or neighbors, you want to keep that social
and those who are engaged socially are healthier physiologically. We're social beings. We're meant to be around other people or to interact with other people or to connect with other people. When we feel isolated, we actually start to develop symptoms that perhaps compromise our immune system, and thereby being counterproductive and making us even more vulnerable to a virus or a bacteria or something of that nature. So being social is actually in our best interest physiologically. So as Dr. Fonseca said, to his point, being social with others and not distancing oneself physically.
And Dr.
Rather, being social and distancing oneself physically.
Right, and.
Yeah.
Dr. Fonseca, we've talked about also if you are in a group that needs to be a little more protective and stay at home, it's so smart to keep active physically and mentally and doing good for others, because you are valuable to the community, even if you are maybe sheltered a little bit more.
I would agree. If I could just piggyback on something that you just mentioned, I think it's always important to do well for ourselves, take care of ourselves first so that we can care for others. But you made an excellent point, Jen.
So if someone calls the University of Holy Cross and asks for, we're going to put the phone number up, throughout the show, but and asks for some help, for some counseling, there are people there who can maybe help them with some of these ideas, maybe how to, a talent they might have not discovered, or the way they can help someone else, as opposed to how they need help.
Sure. It's important to remember that the counselors that are working with clients through the center, through telemental health, are also supervised by the counseling faculty members. And so we work in conjunction with our counselors very closely and are available to them. I think it's important, if I can just add something, it's important for folks who are vulnerable and are still at home to try to pick up a new skill, a new talent. Crochet, knitting, learning a different language, or further learning Cajun French as I'm doing myself. And so it's given me a chance to call out to my family and to friends and to connect, folks I haven't talked to in a while. And I encourage folks to do that, to learn something new.
And nowadays, because of this, there are so many things that are available online. You can really learn a lot of new stuff.
Yeah, and we do live in remarkable times. Yes, this is a very difficult situation, but to that point that yes, you can learn new things, you can develop new hobbies, new activities, and the options are limitless.
Right. Sometimes I think it might be a little scary for some people who aren't used to dealing with Zoom calls or GoToMeetings or anything like that, to learn that new skill. And I guess that's something that people faced before this, and now they're really have to come to grips with how to do this, because it is the future. And I guess that's probably something that counseling can help with as well, that you can do it.
Absolutely, yeah. The counselors certainly are trained to work with people through their anxiety and their worries in dealing with technology. But I just want to mention, you don't necessarily have to Zoom or FaceTime. A good old-fashioned telephone or cell phone can come in quite handy, just to hear someone's voice. You can be coached that way on how to further your understanding and seeing a face in teleconferencing like this.
Do you think there's any guilt in still needing to ask for help, still being, if you have to be at home, if you do need a little more assistance than people who are maybe out and about a little bit more? The guilt of, I still have to ask for help. I still need this. When the world is getting on.
I think we're living in a different age, honestly, where an individual may have a favorite doctor, a favorite dentist, podiatrist, and so on. And counselors have sort of made their way into people's lives. They're available, and individuals have reached out. So I think what you might be referring to is the stigma, possibly, that's associated with reaching out for help. And I love that about school counseling, and that you have a counselor that's available. And we certainly we've been inundated with calls at the counseling center. And so we are very happy that individuals are reaching out for help. So I'd like to think that we're living in a different day and age. And I'm proud to be a part of the profession that I can sit here and say that.
Great. Thank you, Dr. Fonseca. I really appreciate it. And I was really talking about just help getting groceries or help, doing things that they can't get out and do it still.
Yeah, and that vulnerability, that not wanting to ask for help, from a family member or a friend or a neighbor, that's certainly understandable. They're perhaps can become aware that things can be delivered now. There's so many delivery services, that are available in all sorts of different services and goods. Back in the day, you could only order pizza.
Right.
To be brought to the house. Now you can get just about anything at your front door. And so people can be more independent in that way as well, that you can just have something delivered.
Okay. Dr. Fonseca, thank you so much for joining us. Dr. Roy, I want to, if you can give us some tips kind of to wrap this up on the vulnerable population.
Well, I would say that they're going to continue to have to maintain social distancing, or physical distancing rather, for the foreseeable future. Continue to wash hands regularly, something that we've all been asked to be more mindful of and do, just gonna have to do it more consistently. Remembering not to touch one's face during this time, because if you pick up a package and things of that nature, or interact with somebody at your front door, you still want to be able to wash your hands with every interaction. Disinfect shared spaces. This is an important thing too, that if you share space with people who do go out and come back, that everyone be mindful of that shared space and that it stay clean.
What you're bringing in,
for the vulnerable population, and to avoid crowded spaces and to stay informed, because this COVID-19 pandemic is ever changing, ever evolving, and the more you stay informed, the more you are taking care of yourself and staying healthy.
And you feel a little better about knowing what's going on out there.
It's empowering.
Not overdoing it, but
but
keeping it within reason.
Yes.
Okay. Well, thank you, Dr. Roy Salgado, and your colleagues at the University of Holy Cross for joining us and taking us through these issues. And thank you for watching. We want to help as we are all coping during the COVID crisis.